today we're going to learn about the permanent mandibular molars. The permanent mandibular molars are the largest teeth in the mandibular arch. They are also the strongest because of their wide mesiodistal diameter and the presence of two long roots. These teeth serve as very strong anchorage agents. The detailed description of the buccal aspect of mandibular first molar. The geometric outline is trapezoidal with the parallel sides being on the occlusal and the cervical margin. From the buccal aspects, all the 5 cusps are visible. So, you can see 3 buccal cusps and little tips of the lingual cusp also. You can see that out of all these cusps, the mesiobuccal cusp is the largest, followed by the distobuccal and then the distal. The mesiobuccal cusp is slightly flatter from the occlusal surface as compared to the distobuccal, and the distal appears to be more rounded as compared to the mesiobuccal and the distobuccal. There is a little extra ridge seen just above the cervical line. This is called as the cervical ridge, and this is characteristic to the mandibular molars. So, the mandibular molars show the presence of a strong ridge on the cervical area, which is called as the cervical ridge. This cervical ridge is also sometimes seen on the maxillary molars buccal aspect and many times also visible on the mandibular second premolar in the cervical area. You can see 2 developmental grooves from the buccal aspect. The mesiobuccal developmental groove, which is slightly shorter in its length and separates the mesiobuccal cusp from the distobuccal cusp. A second groove is visible, which is called as the distobuccal developmental groove. This distobuccal developmental groove separates the distobuccal cusp from the distal cusp. The distobuccal developmental groove is slightly more longer than the mesiobuccal developmental groove. So, moving on to the outlines of the teeth. So, this mandibular first molar, when you look at it from the buccal aspect, you can see 4 outlines. The occlusal outline, the mesial outline, the distal outline and the cervical outline. The occlusal outline shows 2 slopes. One slope is from mesial to distal and the other slope is from lingual to labial. So, the crown slopes in 2 directions. One is from the mesial, so the mesial being slightly taller and the distal being at a slightly lower position, and the lingual cusp being slightly at a higher position and the buccal cusp being at a lower position. The mesial outline is relatively straight. The distal outline is also straight above the cervical line, then becomes slightly convex at the contour of maximum convexity. The cervical line is concave with concavity directed towards the crown. The surface of the buccal surface is relatively flat with the presence of the cusp. So, in the occlusal area it becomes slightly more convex, but in the cervical area it becomes more flatter. You do have a prominent cervical ridge just above the cervical line. The mandibular first molar also has very distinctive roots. It has 2 roots, one mesial and one distal. The mesial root shows slight distal tilting, whereas the distal root is relatively more straighter. There is a root trunk which is seen just below the cervical line. Now remember, the root trunk is that part of the root which does not show any bifurcation. So, this root trunk is located on the buccal aspect and you can see the bifurcation of the root about 3 millimeters from the cervical line. So, about 3 millimeters below the cervical line, you will see the bifurcation of the roots and the single root trunk gets divided into 2 roots. Moving on to the detailed aspect of the mandibular first permanent molar from the lingual aspect. So, when I look at the tooth from the lingual aspect, the crown of the mandibular first permanent molar appears slightly smaller than the size of the crown from the buccal aspect. Even though I said to you earlier that the lingual cusps are taller and they are visible from the buccal aspect. The reason for this lingual cusp appearing smaller from the lingual aspect is because the cervical line moves a little more occlusally. As the cervical line moves a little more occlusally, the crown appears more smaller. Also, the root trunk appears more longer, giving the tooth a more longer appearance from the lingual aspect. So, from the lingual aspect, the outline of the crown is trapezoidal again with the occlusal and the cervical line appearing the parallel sides of the trapezoid. 3 cusps are visible from the lingual aspects. That is, you can see the mesiolingual cusp, which is definitely larger, the distolingual cusp, which is slightly smaller than the mesiolingual cusp, and you can see a little outline of the distal cusp also. There is a groove which is visible on the lingual aspect, which is called as the lingual developmental groove. This lingual developmental groove separates the mesiolingual cusp from the distolingual cusp. So, when we look at the outlines of the mandibular first permanent molar, you have 4 outlines: the occlusal outline, the mesial outline, the distal outline, and the cervical outline. Now, the occlusal outline is such that it is almost parallel to the cervical line. The cervical line is almost straight with no much deviation towards the occlusal or the root aspect. The mesial outline is relatively straighter and the mesial contact area is slightly higher than the distal. The distal outline is more convex, converging towards the occlusal surface, and the distal contact area is slightly more lower as compared to the mesial contact area. From this aspect, you can see that the crown is tilting more towards the distal from the mesial.